The COVID-19 outbreak of the last few years is not the last infectious disease outbreak we have had to deal with, nor will it be the worst. A new variant of COVID could emerge or some other disease. COVID itself overshadowed a fear of an Ebola outbreak a few years earlier. In light of this, it would perhaps be useful to investigate the moral question of whether one ought to wear a mask when in public. For this video, I want to consider a situation in which a contagious disease is spreading. The severity of the disease and the ease of transmission will be relevant in determining what would be a legitimate response. Unfortunately, with a new disease, it will take a while to find the answers to each of these questions, meaning that we will have to decide on a policy in the dark, in the face of uncertainty. There are people whose job it is to look at the evidence and make an informed judgment call as to the severity and forms of transmission of a disease. And there will be countless internet amateurs making their best guess, feigning different levels of certainty and various sources of information. So let us assume that in the case under consideration, the CDC has issued an advisory that all people wear masks while out in public. This recommendation doesn't come with any legal penalties. We're not talking about forcing compliance. We're asking if there is a moral obligation to follow the CDC recommendations. Here is a basic argument that it would be morally wrong to ignore the CDC recommendations. Premise 1. If you might have an infectious disease and you are around others, you risk infecting them. Premise 2. If you infect them, they might get seriously ill or die. Premise 3. Wearing a mask will help prevent the spread of that disease. Therefore, you ought not to go out amongst others without wearing a mask. The Centers for Disease Control is where one gets the information that premises 1 through 3 are true. They base their recommendation on a detailed study of the evidence that's relevant to each of these premises. One really has no morally responsible grounds to doubt their expertise on this matter. I want to draw attention to the fact that the reason for wearing a mask is not to prevent getting the disease. It's to reduce the risk of transmitting the disease to others. A surgeon, for example, doesn't wear a mask so that the surgeon is protected from whatever biological pathogens the patient may release during surgery. Surgeons wear masks so that they do not infect the patients. I think it would be interesting to ask somebody who would refuse to wear a mask if they would allow a doctor performing surgery on them or somebody they care about to work without a mask. If the site of the operation became infected, would they hold the surgeon morally responsible for the harm suffered by the patient? This is nearly identical to the moral case we're discussing here. If one person gets a disease because others refuse to wear a mask, are those others morally responsible for the harms done? The fact that the wearing of a mask is done to prevent the disease from spreading to others means that this is not a paternalistic recommendation. Recommendations regarding diet and exercise, on the other hand, are paternalistic. The person who ignores these recommendations suffers the consequences. One can consistently argue that there is no obligation to follow CDC recommendations on matters affecting one's own health, but still be obligated to follow recommendations affecting the health of other people. This also means that the message one communicates to others by not wearing a mask isn't, "Look at how brave I am that I'm willing to be in public without a mask." The message is, "Look at how little I care about the lives and health of other people, that I'm not willing to accept even the slightest inconvenience for myself to protect them." As I have written this argument, it has a significant problem. It suffers from what value theorists call the is-ought problem. Philosophers credit the 18th century philosopher David Hume with recognizing this problem. You see, all three of the premises are descriptive claims. They're claims that scientific researchers can reveal by looking at the empirical evidence. The conclusion is an ought statement, a statement about how the world ought to be or what people ought or ought not to do. Hume says that this transition from purely factual premises to a prescriptive ought conclusion needs to be explained. I have a video around here somewhere titled "Deriving Ought from Is," where I explain how I think this gap can be bridged. However, we don't need to get into those particular weeds. A shortcut for dealing with this gap is to include an ought premise and see if the ought premise makes any sense. I recommend the following ought premise. You ought not to do things that risk killing others or making them seriously ill or injured. The moral principle explains why we can morally condemn drunk drivers. They obviously do not care about the risk they are creating to the lives and health of other people. It explains why we would be justified in condemning the person who walks out onto a street with a loaded gun, puts on a blindfold, and then shoots randomly in all directions. This lack of concern for the lives and health of others is morally problematic, to say the least. The person not wearing a mask in public is randomly firing disease bullets in random directions with a chance that some of them might land on and infect others, potentially causing a serious illness and potentially death. On the view of morality that I defend, an act is wrong if it is of a type that people generally have reasons to give everybody internal and external reasons not to perform. So I would evaluate this principle on the grounds of whether people generally have reasons to give everybody reasons to avoid performing types of actions that risk the life and health of others. And it seems quite reasonable that they do, since not wearing a mask in situations where a disease outbreak has motivated the CDC to recommend wearing masks is an act type that risks the lives and health of others. People generally have reasons to give people reasons to avoid performing this type of action. So I would argue that the moral principle needed to link the descriptive premises to the prescriptive conclusion is true. Correspondingly, a person who ignores this principle is effectively telling the rest of the community, I don't care about whether you get sick or die. I'm not willing to undergo even the slightest inconvenience to keep you safe. This is not a type of person that others have any reason to treat as a paradigm of virtue. In a real-world situation like the COVID-19 outbreak, one possible argument against a charge of wrongdoing for failing to wear a mask is to deny the truth of the factual premises. The person not wearing a mask wasn't showing a callous disregard for the welfare of others. They didn't believe that there was a danger. We can see how this works as a defense by asking whether the drunk driver is excused from wrongdoing if the drunk driver sincerely believes that they could drive home safely. Similarly, we can ask if we would excuse the individual who fired a gun blindly on the street if the shooter told us that they sincerely believed that the gun was not loaded. To make the analogy fit better, we can also imagine that the person who pulled the trigger was told by experts, be careful with that, it's loaded, but the shooter decided to ignore the counsel of experts on this matter. In these types of situations, the judgment that one can drive home safely while drunk, that the gun wasn't loaded, and that wearing a mask will not prevent others from getting sick should all have the same effect on the judgment that the drunk driver, the shootist, or the person who refuses to wear a mask in public is guilty of a wrongdoing. Now let's consider some objections. The first objection is that clearly it cannot be the case that all acts are wrong that create risks for others. For example, driving your car creates pollution, even an electric car. That pollution can threaten the lives and health of others. If we adopted a universal prohibition on potentially harmful activities, we wouldn't be able to do anything at all. This objection has merit. Clearly, we cannot prohibit all activities that put others at risk. If this is what morality requires, we would not be able to step outside of our padded cells. What we need to do is to balance the potential risk, the real chance of death and illness as determined by experts, versus the cost, wearing a mask. Now, wearing a mask is no more costly than wearing underwear, which people tend to do without complaining. Second, I've often heard the objection that to require somebody to wear a mask is a violation of their individual freedom. Against this, there are 2 points of note. First, the question of what morality prohibits and the question of what the law should punish are 2 different questions. Morality prohibits lying to one's spouse about what one was doing last night, under many circumstances at least, but does not justify imposing legal penalties. It may be the case that not wearing a mask is immoral, but shouldn't be illegal. But there is a threshold beyond which something like this can be made illegal. A law that makes it illegal to drive while drunk or to put on a blindfold and shoot randomly down a street violates a person's freedom. Yet these laws are considered legitimate on the grounds that the benefits to the agent don't justify the harms done to the lives and health of others. Reasonable people can disagree, as I said above, about whether either of these lines are crossed, the line for moral prohibition or the line for legal prohibition. But the existence of such a line is well supported. A third objection is that the burden of avoiding infection belongs to the people who don't want to be infected. They don't have a right to demand that others wear masks. Against this, we only need to note that the burden of being confined to one's home is a far more significant burden to place on people than the burden of wearing a mask. If this was a valid objection, then by analogy, we could say that the burden of avoiding death and injury from drunk drivers belongs to those who wish to avoid death and injury. That they should stay home, that their desire for life and health doesn't give them a right to deprive others of the right to drive while drunk. But it is far more prudent to condemn the drunk driver than the sober citizen that wants to leave home. As mentioned above, wearing a mask is no more of a burden than wearing any other clothing. Being confined to one's home to avoid death and injury by disease is a far greater burden. I conclude that there are grounds for morally condemning the person who refuses to wear a mask in public under conditions where the CDC might recommend the wearing of masks. The person who refuses to do so is showing the same type of moral failing as the drunk driver, or the person who blindly shoots bullets down the street, or the surgeon who refuses to wear a mask while performing surgery. The effect of masks is to prevent causing harm to others. The type of person who refuses to wear a mask is somebody who doesn't care about preventing death and injury to others.